Good morning. This is Rob Wood with the Michigan Health and Hospital Association, and thank you for joining us for the Streamlining Patient Payments webinar with our endorsed partner, HealthEquity. I wanted to run through just a few housekeeping items before we begin. We're recording today's session to view on demand or share with your colleagues, and all attendees are in listen mode, but please submit questions at any time in the question panel and GoToWebinar, or you can email me at rwood@mha.org. That's rwood@mha.org. And we'll be watching for questions throughout the webinar. You can also email us after the webinar anytime, questions. So let's go ahead and get started. I work with over a dozen of our endorsed business partners at the MHA, and we have chosen these partners to bring vetted and proven products and services to our hospitals in Michigan to help manage costs and efficiencies associated with healthcare delivery. One of our newest partners is HealthEquity, and they'd like to present a solution that could help save administrative costs and burden for our hospitals. We're joined today by HealthEquity, who will give us a brief, just a 25-minute overview of these solutions and allow time for questions at the end. In fact, we began working with HealthEquity earlier this year, and we shifted our own employees at the MHA to their health savings account solutions. So we're very pleased to work with them. So Henry, just want to do an audio check. Can you hear me okay? And I want to see if we can hear you.
Rob, I'm good. Can you hear me?
I got it. So go ahead, right, Henry, and kick off the presentation.
Excellent. Well, thank you for the introduction, and I'm thrilled to be here today. As Rob said, we're going to review some content which hopefully is of value to you all from an educational standpoint. And then, as Rob mentioned, there are some solutions which we'll highlight at the end of the presentation. But really, this is meant to be hopefully very informational for you about the way we are seeing the movement happening from paper and manual processes in terms of getting claims and payments to providers like yourselves to electronic and in digital form. If anything, I think the last couple months with COVID and the way we've adjusted our work lives and has shown that a lot of the things that we formerly did can be adjusted and re-engineered and still be efficient. And to a degree, this presentation, I think, echoes that same sentiment and intent, which is that there's a lot of things that happen in healthcare today which are manual, which over time can be improved and moved to digital form. So, as I said, about 20 minutes, and then what we'd love to do is open it up for questions. As Rob mentioned, there's a dialogue box that you can submit questions to him, and I'll get to those at the end of our discussion. So, the agenda is pretty straightforward. I think I just set it up, but we just want to review a little bit about what's happening in healthcare from our point of view, and we'll introduce the company in a little bit more detail shortly, but really talk specifically about the revenue cycle area, which I'm sure many of you represent within your organizations, and just ways that dollars and remittance advice can move more effectively if they're electronic. The good news is, in many cases, this trend is already well established, and paper is slowly being removed from the pipes of healthcare, but there's still an enormous opportunity, and I'm going to highlight some data in that area. Then we're going to introduce HealthEquity, our firm, and some solutions we have that can help automate both payments and claims. And then do a little bit more of a deep dive on what's happening from our point of view in the state of Michigan. And then for those of you that are interested in learning more about the solution, I'd be happy on behalf of the company to entertain, follow-ups with you individually to look at, whether the solution which we'll discuss is appropriate and whether there's significant volumes for you to take advantage of these cost savings. So that's the agenda for our discussion. If we jump to the next slide, Rob, if anything, as consumers, as Americans, we all know healthcare has always been important. It's been in our own family budgets, it's a big budget line, but it's amazing to the degree last 30 or 40 years that healthcare spending has grown. I guess healthcare and education are the two big lines that constantly go up, and it's a big part of our gross domestic product. As you can see, in 2020, it's forecasted to be 18% of our overall economy, which is just enormous. And you can see the trend line even back 40 years. And it's this projection, I guess, came out before COVID, so it's hard to know exactly whether that 18% will be higher or lower, because obviously there's been a lot more hospitalizations related to the pandemic, but there's also been a decrease in elective surgeries. But I think that beyond COVID, the share shift is really, and the growth is really tied to obviously the increases in of our aging population as a country, with more and more people turning 65 every day. I think it's something to the order of 10,000 or so Americans every day turning 65. So there's an aging of the population and a greater consumption of healthcare happening there. And then there's just an overall trend where there's share shift, as more and more of those dollars are being moved from employers and health plans to consumers. So the challenge is how do you make sure that those dollars are spent efficiently? And that's what we're going to get into right now. So Rob, if you advance the slide, please. So the National Health Expenditure estimates that the United States spends approximately $350 billion a year on healthcare administration costs, which is an enormous number, right? It's not the the trillions that we spend overall, but as a percentage, it's significant. And the amount that is spent on areas including the revenue cycle, as you can see in the lower diagram, that span everything from the patient scheduling and encounter all the way to the claims adjudication, claims payment, and advice. That is estimated to be approximately 12% of the overall $350 billion, to the tune of about $40.6 billion. So it's a big number, and that includes both medical and dental. And so for the purposes of our discussion today, we're going to really focus on that last gear, so to speak, that last one where it says provider is paid by health plan, really looking at the way claims advice comes back into health systems and the way that those payments are moved from health plans or surrogates of health plans like health savings administrators, and as well consumers, as they bear a greater portion of that, how those dollars can be moved in more efficient ways. So we go to the next slide, Rob. That's the gear, right? That's the last piece that where our focus for this discussion this morning is going to be looking at the claims and remittance advice process. So we go to the next slide, Rob. So the good news, as I mentioned earlier, and this is data that comes from an organization called CAQH Core, which is an industry association that really defines the standards for healthcare in the United States between payers and providers, so that there's as possible much standardization as in the way that fields and forms and documents are sent between parties to eliminate unnecessary complexity. And so they're the real champions on things like the 835 format, which has been out now for years, and slowly, more and more of those claims remittances are coming in the 835 process and form versus in the old paper EOB. And you can see in that first diagram up top that today payments are moving more and more in electronic form, which is great. You can see even in the last 3 years, they've gone from approximately 60% electronic to 70% electronic, which means correspondingly about 30% of payments are still coming to providers in manual form. Now, manual form can be obviously a paper check and or a virtual card payment. On the below side, you can see how claims information is being sent from health plans and surrogates to providers. And you can see that in this case, there's a little bit more of a laggard phenomenon where, unlike payments, you're not getting 70% in fully electronic form. You're only getting about 50%, 51% for specifically, and that there's still quite a bit of transactions that are not fully electronic. Either they're partial or they're completely manual. So that's in our point of view, and I think the industry overall is a number you would like to get to literally 100% electronic in both claims and payment. And so you can see, unlike medical, dental's even more of a laggard. You can see that in dental, they've got a huge amount of opportunity to move more and more of payments and the paperwork of dental claims to an electronic format. So there's still a lot of work for them to do there. So if we go to the next slide, Rob, what does this mean in terms of dollars and time? Well, this is some estimates that came from the same organization in terms of the savings from moving to electronic claims, both in terms of dollars and in terms of time, right? From a dollar standpoint, you avoid lockbox fees, you avoid transaction fees when you're accepting a virtual card, and on a claims payment processing time, it's just going to be a lot easier if you get the payments electronically and can post it directly into your depository account versus having to open an envelope, get the check, scan the check, work with your lockbox to do it, and or have your own revenue analyst doing that work. And so you eliminate a lot of transaction fees and time by moving to electronic on the payment side. Similarly, on claims, if we go to the next slide on the remittance advice, 835 is the standard electronic remittance advice for healthcare and dental, and you can see that there's still just how much paperwork there is still slogging around healthcare. That they estimate that there's $1.9 billion in savings for provider organizations by pushing their health plans and pushing other payers that they work with to move to an electronic form, because not necessarily on the transaction cost like you would have with interchange, there's processing time and processing costs related to getting that data off of a paper EOB and entering it into your patient accounting software or what other sort of management software you're using to reconcile accounts. So the difference in doing it electronically versus getting it manual is about 5 minutes in the medical industry. So from our standpoint, and what we've heard from providers around the country and certainly in Michigan, is to any degree that we can be part of the solution that's moving these dollars and these claims remittance advice to electronic form, we want to do it. And so we've been innovating and thinking about how to do that for health systems and providers. So we go to the next slide, Rob. Our intent, obviously, with partnering with the Michigan Hospital Association was really to introduce our business overall, but really to help providers and health systems in Michigan as it relates to how we act as a custodial for many members and citizens in the state of Michigan as it relates to their health savings account, and how we move money on their behalf to providers like yourself. And so everything we just reviewed in terms of being able to move those dollars and claims digitally, we in fact almost act like a payer for our members, because we manage their money and then we pay providers on their behalf. And so we have heard from providers like yourself that there's really an opportunity to help them get those dollars and get those claims advices in electronic form. So what we're going to do now is sort of look at how HealthEquity operates in the state of Michigan and what sort of opportunity there is across the state. But before I do that, just a little bit more on HealthEquity. I think Rob introduced us, and we're thrilled that the MHA, in fact, is, as he mentioned, using our business and solutions for its own employees. But just a little bit more. This is a lot of data on this slide, but just to call out a couple things. HealthEquity, by virtue of the acquisition of WageWorks, has become the industry leader in consumer-directed benefit accounts. So we have a comprehensive, integrated solution that simplifies benefits and maximizes employer confidence with those solutions. And we serve approximately 1 of 7 U.S. households in the country today. As I mentioned earlier, our flagship product is the Health Savings Account, and you can see we have 5.4 million account members. And unlike other providers in this market of HSAs, we have a proprietary end-to-end platform. So that makes us really unique, and it makes us have a lot of responsibility about moving monies on behalf of our members to providers who are seeing our members as patients. And so we are moving their dollars to you, and that's what we're going to talk a little bit more about now. So, Rob, if you wouldn't mind going to the next slide. HealthEquity works with lots of hospitals across the country. You can see we have about 82 different health and hospital systems where we manage their employees' HSAs and other solutions, including the FSA, HRA, and commuter tax product. And you can see, to my earlier point, that HSA really dominates the overall product mix. So 257,000 healthcare workers have their health savings account administered by HealthEquity. In the state of Michigan, if we were to do a little bit more of a deep dive on that, and we go to the next slide, Rob, you can see we have over 3,600 employers, and we have, again, lots of HSAs, FSAs, HRAs in the state. So there's lots of Michiganders who have our account and our product in their wallet that they use for qualifying healthcare expenses. If we go to the next slide, Rob, the story is about each year we move about $500 million in paper checks and virtual card to U.S. health systems and providers. In the state of Michigan, which is one of our largest states, we move, in 2020, we are forecasting to move about $27 million in money on behalf of our members and your patients to you in the form of paper checks and virtual card. What we've heard from many health systems nationally and in the state of Michigan as well is there an electronic alternative? Is there a way that we can get those dollars more efficiently? And the answer is yes, right? And you can see up on the diagram here on the left on the bar chart, today only about $186,000 is being moved from us to providers like yourselves in the form of an electronic fund transfer. So literally all that check and card volume could move to an electronic payment and an electronic 835 format. And so that's what we'd like to introduce and talk a little bit more about now. If you can see the next slide, Rob, or show us the next slide, you can see what this sort of looks like on a monthly basis, just in the state of Michigan. We're moving about $2.5 million a month to Michigan providers in the form of check and virtual card. We can go to the next slide. What we've done here is sort of look at the distribution of the top health systems and hospitals in the state of Michigan. We've anonymized this, so we don't have the names of the hospitals, but you can see that there are several, I think there are 20 hospitals here on this diagram that have over $100,000 in payments from us on behalf of our members and your patients that are coming to you in non-EFT format. So either as a virtual card or as a paper check. And you can see the number one hospital there is getting almost $3.5 million a year in paper checks and virtual card. So obviously we've been thinking about this, and we've heard from many of you that we would love for there to be an electronic alternative. So why don't we jump into that part of the solution? Rob, if you wouldn't mind going to the next slide. As I said, today our members use their debit card for about 91% of all their payment transactions, meaning when they go to a provider, they're using that debit card to pay for their copay. Oftentimes they'll use that debit card to pay, you know, after a claim's been adjudicated and there's a balance due. But we have a lot of our members who come to our website to see that a claim by 2020, you know, it's expected that, you know, about $45 billion in healthcare spending is going to be on an HSA. So that's a huge increase. As you can see, it's up roughly $20 billion in spend from 2016. So our goal here is to, again, introduce you to this electronic solution. And Rob, if you go to the next slide.
It should go. Just a second. We had a hiccup with our, but it's okay. It should advance just a minute. How's that?
Yeah, that's perfect.
Okay.
The benefits, you know, it costs more to process a paper check. It costs more to accept a virtual credit card from an interchange rate. Oftentimes when we're mailing checks on behalf of our members to providers, we are dealing with PO boxes. In some cases, we're getting the wrong PO box from the payer who's telling us where to send payment, and therefore there are delays in you being able to post those payments to the appropriate patient member account. So we are at a point now where we have partnered with a third-party vendor called Vpay to enable all these dollars and all these claims to be sent to you electronically. So if we go to the next solution, sorry, the next page. Why is it better than paper check? I think I've summarized this already, but you know, it's safe and secure. We're sending it via an SFTP, you know, server and file protocol, so that it goes right into your account. It's not sent by mail. It's not faxed to you. It goes in electronically. And from a processing, you know, cost standpoint, it's going to be cheaper. You're going to get paid more quickly, and your transaction fees are going to be lower on EFT. So from our standpoint, it's the perfect time, especially in light of all the cost pressures that hospitals are in nationally, and I'm sure Michigan is no different with COVID and trying to deliver excellent clinical care where budgets are tightened, is to help you identify an area where you can reduce costs as it relates to getting paid and making it easier for you to get paid. So that's in effect the benefits of the solution. It's very simple to enroll in this product, and we have now dozens of providers across the country who have enrolled in this new electronic solution, and we can bring partners on literally within a week or two, not requiring big technology or development resources like you would see with other revenue cycle software and systems that many health systems have implemented, which take task force and project teams to deploy. This is a very, very simple switchover. So as I mentioned, my objective for this discussion was just to hopefully share this educational content around what we see happening in terms of the move to electronic forms, how we're pioneering and introducing a solution on behalf of our members to providers across the country. We want to introduce this to you in Michigan. We have lots of volume that could be moved to this digital form. Here's my contact information. I think the desired follow-up, if you're interested to know exactly where your health system falls on this and how many dollars we move on behalf of our members to your patients, and to your organizations on behalf of your patients, I can quantify that for you. I typically just need a tax ID, and I can look up exactly what that is. Likewise, I've got my colleague Michael Zell's on the phone. Michael's a Michigan native son, and he is our enterprise sales executive for the state of Michigan, and he works with employers in the state, many of who are health systems, to explore whether their employees and whether their benefit executives would benefit and would like to look at our suite of solutions for HSA and other tax preferred solutions. So I encourage you to keep our numbers or emails, and if you would like to learn about HealthEquity overall, to reach out to one of us. Obviously, if it has to do with the payment solution I just reviewed, I'd be happy to really look up the numbers and dialogue with you about how we can begin the implementation process. But that's all I had for our discussion. I know we had 30 minutes and I've used up most of it, but why don't I stop there?
Well, thank you, Henry, and we do appreciate this solution, introduction to Michigan hospitals. We do have a couple minutes for Q&A, and so as a reminder, if anybody in the audience has a question, an additional question, please submit that in the question panel, and we'll try and address those either now or with a follow-up. The question I have here, Henry, is what is the cost for this solution?
Yeah, great question. So there is no implementation or conversion cost for this, but there's a transaction cost of $1.50 per payment and per EOB. So you get per 835. So per payment and per 835, it's one fee of $1.50 per unit. So you're not being charged $1.50 for each, but for one payment, 835 together, it's $1.50. Which, if you compare that to 2.5% or 3% that you pay for interchange rate on a $200 patient balance, this is going to be $3, $4, $5 less expensive on a unit basis than taking virtual card. And some health systems are spending $4 or $5 per check to have those processed. So you're saving on a unit basis with this situation, with this product.
All right, thanks. And the only other question is, I know you kind of touched this, but what do I need to do to quantify the savings for our hospitals?
Yeah, so in that 27 million that I showed you that we're forecasting for 2020, I've got literally thousands of Michigan providers ranging from one doc primary care practices that are getting paid by a patient who is also a HealthEquity member, to hospitals that are, as you saw, generating close to $3.5 million in paper check and virtual card that can be moved to electronic. So the best way to do it is just to email me that you would like 15, 20 minutes. You want to share with me some tax IDs. I can look up the data and tell you where you stand year to date. And if this is something that's interesting, we can quantify what the savings would be for your organization. And then we would set up a phone call between yourself, myself, and our partner, Vpay, to enroll you and enroll those tax IDs in the electronic method. Pretty simple.
All right, well, sounds good. Well, thank you, Henry. That's all the questions I have in our box. So I think we'll go ahead and wrap up today's webinar. As a reminder, we will share a copy of the slides to the attendees. But if you have additional questions, feel free to reach out to Henry or Michael, or you can reach out to me at rwood@mha.org. And again, thanks for taking the time out of your day to join us, and we'll be in touch soon. Take care, everybody.
Thank you.